Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions that'll make a better system for all of us. We have a number of topics today, including the Emergency Treatment and Labor Act and private equity in healthcare. Before I get to those, though, I want to point out that down below in the YouTube description box, you'll see the address for the Healthcare Advocacy newsletter. And if you go to that newsletter, go to that address, you can of course subscribe for free to the newsletter, but that newsletter is the text for today's video. And I have links in the newsletter that'll take you to all the news stories and medical journals and actions. And there's actually also a host of references for other organizations. There's abortion references. There's a whole bunch of stuff down at the bottom. So feel free, all of that is free because I retired. Okay, so let's get started. Let's talk about the Emergency Treatment and Labor Act. It was passed in 1986, and you've probably heard a little bit about it in the news in the last few months. This federal law requires facilities that accept Medicare funding to provide a medical screening exam to anyone who shows up at their door and offer stabilizing treatment if needed. Doesn't matter who you are, rich or poor, insurance or not. It was to have been a warning to private hospitals in 1986 when it passed, because they were dumping pregnant patients, like saying, go away, and gunshot victims. They were sending them over to public hospitals and saying, we don't want to treat them because we're not going to get paid. Anyway, emergency rooms without the resources or staff to properly treat that patient are required to arrange a medical transfer to another hospital after they've confirmed that the facility can accept the patient. No shunting them from place to place to place to place, okay? And this can happen. Let me point this out again. This can happen to you if the emergency room is heavily booked. It can happen. It doesn't matter what your insurance is or what color you are or how rich or how poor. If they're too busy to take you, too bad. The author of the bill that passed in 1986, he was a senator. I'll just read you a quote from him. He says, all Americans, regardless of wealth or status, should know that a hospital will provide what services it can when they are truly in distress. The rest of this article is to show you that this is far from the case. The problem of dumping patients is not new. A report that was published by the United States Commission on Civil Rights 30 years after the law's passage, if I do the arithmetic, that's 2016, found that there is insufficient regulatory oversight for the law. And of course, if you go to the newsletter, I've got a link to their report. Now, current day, 2020, I'm going to give you data from 2022. Since 2022, 100 emergency rooms nationwide have mistreated or turned away pregnant women since 2022. Doesn't matter, rich or poor, they're turning them away. One woman in Louisiana at Our Lady of the Lake Hospital was having contractions every 2 minutes. I mean, that's like getting ready to deliver. They refused to stabilize her. They put her in an ambulance to be taken elsewhere. The baby was born in the cab of the ambulance. Inspectors determined that the hospital's emergency room staff members violated the federal mandate 7 times since 2017. They refused surgery to a Medicaid patient with a broken spine. They left a suicidal teenager unattended in the lobby. They failed to examine another pregnant woman before sending her to another hospital. You can't do that. Other emergency rooms denied care to pregnant women, sometimes just leaving them to miscarry in bathrooms. And this is like anybody. I don't know if you've heard this, but they did this to a woman in Texas who was a high-power attorney. You can't do this kind of stuff. They were left to deliver babies in cars or develop risky infections. Now, I got to tell you, when they say risky infections, what that means is sepsis. And sepsis is blood poisoning. It can quickly scale up to fatal, and it certainly can make sure that you don't ever get pregnant again. Some hospitals repeatedly flouted the mandate. They just choose not to do it, choose not to help without consequence. I'll give you another example. One Tennessee emergency room had such long wait times that a pregnant woman had to be hospitalized for a week after an 8-hour wait. Didn't matter whether she had insurance or not, they weren't going to treat her. And a man with chest pain, good luck, collapsed and died in the lobby. Health and Human Services has sent letters to hospitals repeatedly reminding them of the law and the penalties. Can be up to about $129,232 per violation, or they could lose their Medicare funding. The sad part is that the government doesn't want to take away the Medicare funding because so many people nationwide depend on it. So it is a tough stick to hold in your hand. Anyway, HHS last year announced that 2 hospitals, Freeman Health in Joplin, Missouri, and the University of Kansas Healthcare System in Kansas City, Kansas, ran afoul of the federal law because they refused an emergency abortion to Melissa Farmer, the same woman. Doctors at both hospitals told the 41-year-old Missouri woman her baby had no chance of surviving after her water broke at 17 weeks. But because the states had abortion bans in place, her condition needed to worsen before they would terminate the pregnancy. So we'll just let you get close to death, and we'll see if we can bring you back. A Tennessee hospital agreed to pay a $100,000 fine for a 2018 case involving a pregnant patient who was discharged and gave birth in a car at 42 weeks pregnant. A Kentucky hospital was fined $90,000 for refusing to help a patient with an ectopic pregnancy. That thing ain't going nowhere. And of course, if they do it too late, you lose fertility. That was in 2021. After a complaint against the hospital is filed, a state surveyor investigates the hospital. A physician and the federal government review the findings to determine whether or not the patient received inadequate treatment. If an emergency room violated the federal law, the Center for Medicare and Medicaid Services may refer the case to the Health and Human Services Inspector General to consider penalties. Look, the bottom line is that patients in critical need are being mistreated. Sometimes it's because they're pregnant, sometimes they need an abortion and the doctors are scared to do it. Sometimes they have no insurance or they're the wrong color or race. Sometimes it's because a private equity firm or a commercial enterprise owns the hospital and has purposely understaffed the emergency room, and then it doesn't matter who the hell you are. You can just sit there and wait until we get ready to take care of you or not. I'll tell you, it happened to a friend of mine who wound up having heart attacks in the emergency room after they warehoused him for 11 hours. Justice is slow, and complaints take time to investigate, and when a life is on the line, it is just too little too late. Universal health care would help with the insurance part of the issue, if that's an issue. The Women's Health Protection Act would help with the abortion part of it and make it legal nationwide so doctors aren't scared to do their job. Racism requires diversity training, and I got to tell you, the extreme court shot that down for medical schools by saying they can't seek to have a diverse school population. And what helps diversity is being exposed to people of different races, creeds, and colors, so you know everybody's just the same. But that takes time. And of course, private equity, we're going to address that in the next article because they're screwing this up all on their own. So look, what can you do about this? This is a horrible situation. All I can tell you is come this November 5th, vote accordingly. Just vote accordingly. Okay, anyway, Health and Human Services information for filing a complaint I've put into the newsletter. I'll read you what they say on their website. It says, have you been denied treatment to stabilize your emergency medical condition in a hospital emergency department? Because of EMTALA, you can't be denied medical screening exams or treatment for an emergency medical condition based on whether you have insurance or not, whether you can pay for treatment or not, your race, color, national origin, sex, religion, disability, or age, whether you are or not a citizen. Learn how to file an EMTALA complaint here. Of course, by the time you get to the link to file the complaint, it's too late. You're already in trouble. And of course, that doesn't do anything to address the private equity portion of them screwing up the emergency room and understaffing it. Okay, let's get to the next one, private equity revisited, because this is where we can affect that one. When private equity firms take over a hospital or healthcare facility, prices increase, quality declines, and workers are forced to do more with less. I'm going to go off script and tell you, when they take over nursing homes, it actually has been documented that the death rate in the nursing home in 1 year goes up by 10%. Also, the number of accidents in a hospital after private equity takes over rise significantly, and they're for things, infections and slips and falls that should never happen because they're understaffing. Okay, in November 2010, the global private equity firm Cerberus, you know who Cerberus is? It's the dog, the three-headed dog that sits in front of hell. Cerberus Capital Management bought 6 Massachusetts hospitals in an $895 million deal through the newly formed Steward Healthcare. By 2017, they'd taken over 37 hospitals in 10 states, according to the Private Equity Stakeholder Project. That's a nonprofit watchdog group. The CEO of Steward Health, his last name is Dilatori, he loaded the hospitals with billions of dollars in debt, sold the land underneath them to the Medical Properties Trust, a real estate investment group, and then had the hospitals pay unsustainably high rents where before they owned the land. Steward Health has closed 6 hospitals since 2018, laid off about 2,650 workers, and cut vital services across hospitals, including obstetrics, behavioral health, and oncology. In May, Steward Health filed for, guess what? Bankruptcy, and they announced plans to sell the other more than 30 hospitals. Meanwhile, Dilatori spent $160 million on a yacht, 2 private jets, luxury fishing boat, and donations to an elite preparatory school. An estimated 15 patients in Steward's hospitals have died due to lack of medical equipment or staff. Thousands more were put in danger. At one hospital in Brockton, Mass., an 81-year-old man with pancreatic cancer got to die in the waiting room of an emergency department because it was understaffed. At another, a 28-year-old patient in acute mental health crisis went into distress and died. A 39-year-old woman who had normal childbirth bled to death. Her life might have been saved by an embolism coil. This is used to stop serious bleeding, except that because they had cut back on equipment and were saving money to squeeze it out of the system, those coils had been repossessed by the vendor weeks earlier, so she got to die. Audra Sprague, who's a nurse, former nurse at Neshoba Valley Medical Center in Lunenburg, Massachusetts, brought her 18-year-old son in diabetic ketoacidosis to her hospital. He had been newly diagnosed with type 1 diabetes, and he was admitted to intensive care. However, due to staffing shortages, he got to stay in the emergency department overnight, where there were 18 patients and 2 nurses. No matter how hard or fast they work, there is no way for two nurses to care for 18 patients. According to Nurse Sprague, RN, who's an RN, according to anybody, the hospital's local leadership asked for a 3rd nurse for night shifts, but corporate negotiators said, no, pound sand. So his mother got to be his nurse that night, not his mother. What a charming place. Okay, look, the Senate Health, Education, Labor, and Pensions Committee, that's HELP, is going to meet this week, September 19th, to finalize a contempt resolution for Dilatori, because he was supposed to show up a week ago on the 12th at the HELP committee and talk about how he has screwed this healthcare facility and just squeezed the money out of it like crazy, letting people die. And what did he tell the Senate committee when they gave him a subpoena? Pound sand. I don't know where people get this. There's just complete lack of respect for law. Okay, anyway, there's a way to fix this. Senator Markey and Representative Jayapal have submitted the Health Over Wealth Act to Congress. It is Senate Bill 4804 and House Resolution 9156. If you look up 9156, it actually has a different name, but it's the same bill. It'll fix the behaviors that for-profit firms use to squeeze out profits from healthcare systems and then leave them to die in bankruptcy, threatening the health of their communities. I'll give you a synopsis of what the bill does. It requires that private equity-owned healthcare facilities publicly report on their debt and executive pay, lobbying and political spending, healthcare costs for patients, and insurance plans, and any reductions in services, wages, or benefits. Before I go on, let me tell you, the reason looking at that debt is so important is that the law allows them to put the hospital into huge debt and then take that money and pay it as dividends to the investors. So the investors don't take on the debt, the hospital does. Okay. It requires that private equity-owned firms set up escrow accounts to cover 5 years of expenses to ensure continuation of care in the event of a hospital closure. You know, Steward Health, they don't have 5 years worth of money hanging around to take care of it. And they never would have bought in if they would have had to pony up 5 years worth of funding for each hospital they bought. They couldn't do it. It authorizes the Department of Health and Human Services to revoke the investment licenses from private equity firms that price gouge, understaff, or create access barriers to care. It establishes a task force to review the role of private equity in the consolidation of healthcare, including how market trends create or exacerbate healthcare disparities. It prohibits the private equity firms from stripping assets from healthcare entities or undermining the quality, safety, or access to healthcare. And my favorite, it closes the tax loopholes for real estate investors in order to disincentivize the healthcare entities from selling the property underneath them and then paying exorbitant rents to these investors. It also calls for a review before the hospitals or medical facilities are purchased. Look, you can tell your members of Congress and your senators it is time to pass the Health Over Wealth Act and protect the ability of their constituents to get health care when they need it. Remember, this has nothing to do with your income level or whether you have insurance or your race, creed, or ethnic anything, or how much money you got. When they understaff that facility, all of us are screwed. Okay, here's the action. As I said, you can call or email your representatives and senators, and I'll put a link to how you can get in touch with them in the YouTube description box. My favorite, use ResistBot on your cell phone. Send a text message to 50409. It is sign, S-I-G-N, space, PBDMMH, sign, space, PBDMMH to 50409. Here's the message you'll send. I'm your constituent, and I want you to know that private equity investment firms are squeezing the life out of medical communities. Steward Health's bankruptcy is just the latest debacle. They load facilities with debt to fund supersized dividends to investors and then force the facility to pay extra high rents. Critical functions like maternal care, cancer treatment are often removed because they are insufficiently profitable. Then, after the money is squeezed out, they declare bankruptcy and leave the communities devastated. Steward Health is the latest, but the list goes on all the time. Ask any constituent in a rural area. You'll hear about this. Look, you can fix this and help your constituents. Get the Health Over Wealth bill to a vote and passed. And here's what it does. It provides for HHS review before the sale can occur. Excuse me. It establishes an escrow account with funding for 5 years of operations, so communities aren't left helpless. It requires transparency about financial and management operations like debt, executive pay, lobbying, political spending, healthcare costs for patients, and insurance plans, and any reduction in services, wages, or benefits. You better be sure that if that stuff is public, those places will be shamed into not doing it. Authorize the Department of Health and Human Services to revoke investment licenses from private equity firms that price gouge, understaff, or create access barriers to care. It prohibits private equity firms from stripping assets from healthcare entities or undermining the quality, safety, or access to care. Closes those tax loopholes for real estate investors in order to disincentivize healthcare entities from selling their property and then paying exorbitant rents to investors. Here's a link to the bill so you and your staff can go and read it. Get it passed. Thank you in advance for protecting your patients. Now, before I close out, I want to tell you there are 4 actions that we can all take that are justice and equal rights related. These are all easy, mostly one click after entering your name and address. Each of them, when you go to the URL for each action, down at the bottom where it'll say start writing, down below the start writing it says edit subscription preferences. Click on that and just unclick the contact me choices, and if you do that, they won't get in touch with you further. Here they are. Number 1, fire Jesse Walters for making a rape joke about Vice President Harris. What a turd. Tell your representative abortion is a human right. Pass the Women's Health Protection Act and protect abortion. That restores Roe v. Wade nationwide. My favorite, tell Congress now's the time to ratify the ERA. You know, that started when I was a kid and I'm in my 70s. Okay, if I can get the URL for them into the YouTube description box, I will do it. If that doesn't work, go to the newsletter. They're all in there. That's what I've got for you. Down below, please like, share, and subscribe. You can also send me comments, requests for research, or send them to me at healthcareadvocacy1, all one word, @gmail.com. That's what I've got for you. Have a good day.